Hi, everyone. Welcome to episode 18 of Doc to Doc podcast. We're so excited to have you here. Today, we have a very special guest, Dr. Andrew Freeman, who's a cardiologist at National Jewish Health in Denver, Colorado. And we're here to talk about lifestyle medicine and specifically how you can keep your cardiovascular system healthy. So we're so excited. I have a brief bio about Dr. Freeman. So he completed his training at medical school at SUNY Buffalo, and then after graduating from Cornell, and then did his internal medicine at Brown University and cardiology training at Temple University in Philadelphia. He serves as the director of clinical cardiology and director of cardiovascular prevention and wellness, and is an associate professor of medicine. He hosts the monthly Walk with a Doc program. And Dr. Cohen, who we previously interviewed, is a part of that and recommended we speak with Dr. Freeman. And he heads up the Ornish lifestyle medicine program at National Jewish, which I think is so cool. So welcome, Dr. Freeman.
Well, thanks so much for having me.
We just had a couple questions here and just wanted to start out and just maybe talk a little bit about your experience caring for cardiovascular patients and how you got into lifestyle medicine.
Sure. Well, so I mean, it probably goes back to when I was a kid. I grew up in New York and, never really took it in and understood exactly why all of my friends' parents were either dropping dead, having heart attacks, or cancer early in life. And then when I think about how I grew up, right, it wasn't a bagel and cream cheese. It was a bagel and 3 inches of cream cheese. It was, a pizza weighed 5 pounds, or it was 7 inches high of pastrami. So we ate like kings and queens. We didn't move very much. And I never really added it up in my brain, believe it or not, and then went to med school in Buffalo, home of the Buffalo wing, of course. And then in Rhode Island, where you could get all sorts of greasy and delicious things. And then I trained at Temple in North Philadelphia, and the healthiest thing around the hospital was a soft pretzel, if it wasn't a cheesesteak or greasy Chinese food or whatever. And I never really, thought about this. It wasn't really taught. Medical school, we learned nutrition for burns. They told us to push boost on people, which is basically just cheese byproducts, and hope for the best. And, we would see young people who ate poorly or had bad genes or both, that had heart attacks. And we say, don't eat cheesesteaks. And then we would go eat a cheesesteak for lunch. So nothing really added up. So like every good cardiology fellow, I kind of conformed. And then when I came out to Colorado, within a year or so, 2 years, maybe at the very most, I was throwing pills at people like everyone else, and nobody really got better. So then I started walking with my patients once a month on a weekend, and people really got inspired by that and started to get a little better. And I said, well, I bet I can do even better. So I started reading about nutrition, and I was floored at the knowledge that I never had. I couldn't believe that all of this information was not routinely discussed in everyday practice, especially with the exploding costs of medicine and how sick people were getting. And so we were up in Steamboat on a family vacation. I was reading the China study. And if you haven't read that, you should definitely read it. We had a greasy cheeseburger for dinner, and that was my last ever. And from that point forward, I became plant-based. And I not only lost the 30 plus pounds I gained during fellowship, but redid my own life insurance physical and got a rebate check in the mail. So I said, there must be something to this, and then started doing it with my patients. And for the first time ever, I would see blood pressure go into remission. I'd see asthma go into remission. I'd see heart failure normalize. I'd see people just get their lives back. And I'm like, my goodness, this is what I want to do. So now I work, at a big respiratory hospital. I take care of all sorts of absolutely rare and random things that most of us read during medical school training in those big books that most of us can't recall anymore. And now I get to see people get better, and I incorporate nutrition and lifestyle into every single visit because it really improves outcomes so very much. And now, when I started out 11 plus 12 years ago doing this, I was definitely a fish swimming upstream. And now there's more fish swimming upstream. And, for the most part, almost every professional society on the planet now endorses this approach. And the results are extraordinary. They really are probably the most powerful and inspiring that one could ever hope for. So bottom line is, I wish I would have done this sooner. And I wish it would have been part of our education process a lot earlier. So.
Yeah, we've
It's
talked
great.
about that previously on the podcast about how that kind of part about lifestyle was kind of just omitted from the curricula. Abbas, would you like to take the next question?
Sure. One of the things that I run through with our plant-based diet, they eat a lot of processed food, and I have tried to very much encourage them to not, it's great to be plant-based diet, but also the processed food and packaged food and taste enhancing food, those are sometimes called as bad. How do you approach that with the patient, that tell them to stop the processed food while you eating a great diet?
So there was a couple of studies recently published that actually showed that if you are a junk food vegan, right? So remember, Oreo cookies and licorice and Coca-Cola are all plant-based, that you actually do worse than an omnivore. So in general, I usually tell people that we need to eat like peasants if we wish to live like kings and queens. So what does that mean? It means that you shop in the produce section, you get what's on sale, fruits, vegetables, whole grains, rice, oats, whatever it is. And I think if we do that, the results will be extraordinary. And that's basically it. So when people say to me, well, I eat Beyond Burgers and Impossible Burgers and, all this stuff, I would say, look, they're better than the original, but they're very, very high fat. They're highly processed and they're probably not healthful. So getting people to realize that we're supposed to eat in an unprocessed whole way is very challenging. And where I grew up, right? I mean, anywhere you go, ultra processed foods are the first thing you see. You get gas in your car, or if you electrically charge it and walk into the convenience store, what do you see? It's just all ultra processed foods. One of the things I say to my patients are, the longer the shelf life, the shorter your life.
Exactly.
So I try to get people to really understand that, but I think you bring up a great point. It's not just being plant-based, it's being whole food, unprocessed, low fat, plant-based. And I want to point out that people say, well, tofu, that's processed, right? It is, but it is minimally processed. If you take an edamame and you put them in a bag, technically that could be processed. I would say that's not the kind of processing we're talking about. We're talking about a meaningful transformation of the product far away from its original. And some of these time-tested things like fermented tofu or fermented wheat gluten, tempeh, and these are not harmful things. So,
Yeah, I live opposite of you. I was born in a tiny little village in Iran, which were near 90% whatever we grow, we ate. And when I came to America, it was shocking. And that's probably one of the reasons I went to GI, because I see what the people eating. And when you look at the studies, it proved that you need to eat fresh fruit, fresh vegetables, and eliminate the processed food. But it's a war. It's a war against, us against the food industry. And even you go to your hospital, you go to a physician lounge, is nothing but processed food and sodas and Cheetos and all of that. So it's challenging, but I think the whole country is ready for a change, and I'm so glad that you leading some in Denver, and here Rob and I, we're trying to at least initiate to wake our patient up that I tell people fast food, fast life. So sometimes the more spending time in the kitchen, the less in your doctor's visit. And of course, you see the end stage of it. We deal with heartburn and digestion. You end up with cardiology. I says, who gets heartburn? It means you're gonna die of heart disease. It's not from Barrett's esophagus or esophageal cancer, very rarely.
yeah, you bring up some great points. So, first, I always tell people that if you go back, no matter where you're from, and you go back to your grandparents' generation, and you eat the way they did, chances are you were eating very little meat because it was very pricey and rare in the diet. And you were eating fruits, vegetables, potatoes, grains, whatever it may be, beans and rice in many places. And that's a healthful way to be. And then more recently, and where I grew up in New York, it wasn't dinner unless there was a big piece of meat on your plate. What I always tell people is, if you don't want to go all the way, which, I understand, although I would tell you that you probably should, it shouldn't be a big piece of fish on your plate and a few carrots on the side. It should be a big plate of carrots and a bite of fish. But the more you learn about your food, the more you're not going to want to eat that stuff anyway, right? Like even fish loaded with PCBs, dioxins, heavy metals, organophosphates, microplastics, nuclear fallout. And if we all ate fish the way our professional societies recommend, there wouldn't be a fish left in the ocean tomorrow. So, the more we learn, the more we have to change. And I think the future of our planet, the future of our health, the future of our society depends on us making these massive changes now. And it's crazy to me that doctors are kind of poo-pooing the environment. Well, I didn't go into medicine to talk about the healthy environment or the planetary health. But at the end of the day, without planetary health, there's no health at all, right?
Exactly.
So we all have to think about these things. And so I think you bring on a lot of really important points. And one of the things I tell my patients, especially if they're not from the United States, is I say the first thing you want to do is not eat like an American. The second thing you want to do is figure out your great grandparents' seasoning, sauces, salsas, whatever it is, because you could take the most bland vegetable that's maybe not even fully ripe and put it on a good sauce, and all of a sudden it's delicious. And all those sauces are made out of spices and vegetables. So I think you bring up some really important points, and we have to do better. But here's the clincher. You'll love this. So I helped to found the American College of Cardiology's Nutrition and Lifestyle Work Group, and we published a survey of 1,000 cardiologists. And it turns out that almost none of us know anything about nutrition, and very few of us are eating more than just a handful of fruits and vegetables a day. The USDA says we're supposed to get between 5 and 13 servings a day. And I think that I probably get, I don't know, 14 or 15 at least. And I think that the vast majority of people are getting 1 or 0. It's just mind blowing. And these are doctors. So,
Dr.
Yeah.
Freeman, sorry, go ahead.
No, that says you bring a great point about the salsas and all of that. When you look at I'm from Iran and India and many Asian cultures, food was a medicine. That those salsa stuff like that, was all anti-inflammatory as well, not only for cardiovascular well-being, is for preventing pain and arthritis and inflammation and all of that as well. So it's great to go to those ancient recipes, and because before 1990s, it was 1900s. I mean, the truly food was medicine at my home. My grandparents, my mom, they always matched the process. I mean, the food that they're processing and cooking based on the season, based on the temperature outside, based on what you're eating and what your plan is for the next day or so. So these are great things to go back and learn from our past. Go ahead, Rob.
Could you talk a little bit about the link between sugar and sugar equivalents, like, white flour, cardiovascular disease? That's something that I've noticed in patients. When they convert over to plant-based, or they're trying to go more plant-based, they end up eating a lot more sugary foods.
Yeah, no. So a couple of points about sugars and so forth. So first, I never recommend added sugars. The sugars that come naturally in fruits and vegetables are great. And I think that's important for people to hear. And then you may see, actually, some news got released today about how some of the artificial sweeteners, erythritol and others, may actually be linked to early cardiovascular disease. So what I usually tell people is, diet soda is just as bad as regular soda, and the perfect beverage for human consumption remains water, with a close second by unsweetened tea and unsweetened coffee. The other thing you'll often hear is about sugar and diabetes. So what I would tell you is, first, the causative feature of diabetes is not necessarily sugar. It's really fat excess. You get fatty deposits in the liver, and Abasi, you probably see this all the time. If you have a patient who has fatty liver, almost always they're either pre-diabetic or diabetic, but they also have fatty deposits in the muscles. And then as a result, when they eat sweet things or white carbs or sugars, their glut receptors don't work as well, and so their sugars are higher. So you'll hear people say, well, you can control your carbs and your sugar will be better. That's true, but it is a subset of the truth. The cure for diabetes, which was proven in 1940 by Walter Kempner at Duke, was the white rice and fruit diet. So he fed his patients sugar and had them walk all over North Carolina, and cured diabetes and heart disease in the vast, vast majority of them. So eye-opening data back from, what seems like almost 100 years ago. So what I would say is this, we know that diabetes, if you have it, and we know that excess sugar, if it's in your blood, is a toxin to a lot of different organs, including blood vessels. So diabetes is considered a coronary artery disease risk equivalent, and we treat, coronary disease risk factors even more aggressively in diabetics. But I would say that in general, surprisingly or unsurprisingly, when people eat fruits and vegetables that contain sugar, many times their blood sugars don't necessarily spike in the same way like if they were to eat a candy. Now, here's the problem. I can give you the most ripe strawberry, raspberry, whatever your favorite fruit is, and it will absolutely pale in comparison to, some artificially created sugar candy. So our sweetostat, if you will, our thermostat for sweets can be adjusted in a way that you don't find fruit nearly as delicious until you stop eating it for a couple of weeks and see how it goes. Same thing for salt. Most of my friends and colleagues growing up salt their food before it even gets in their mouth. And then as a result, their salt thermostat is up at the, super high. So bottom line is, I think we can do a lot better. And I would, don't get me wrong, right? Once a year, you want to have a whatever, go for it. I would tell you that these days you can find a vegan version of virtually any sweet you can imagine that's absolutely delicious, but it doesn't mean that it's healthful. So you really should limit those.
Exactly. And also another thing is that these taste enhancing chemicals that they put on sodas and sugars. And I tell my patient, as long as you drink soda, particularly I think diet soda is worse, that you cannot drink water. It's not palatable. The next one, you just want more and more. It becomes a behavior that you cannot stop unless you stop it for a couple of weeks, then starting from water, then the water. There's a lot of times they hate the water as well because you're drinking so much sugary drinks, whether it's Gatorade, whether it's soda and all of that. And that's the same thing with salt and the same thing with fast food. It's like you become a sort of rat in this environment and just they keep feeding you all of that. And you just completely, you become their instrument of buying their product.
Right.
For example,
they've deregulated your control mechanisms.
Exactly.
I would tell you that, with all due respect, Coca-Cola or Diet Coke for that is the perfect neuroaddictive substance. It's amazing, right? Like I used to drink when I was in medical school 5 a day before I discovered coffee and tea, not realizing that it was doing me harm. And I guess what I would say is that in general, food manufacturers have figured out how to make things unbelievably irresistible. And I think this is in part why there's all this dysregulation in human bodies and so much obesity that's going on, because it's easy to override brain mechanisms that were in place. We all crave sugar and salt. And these were the reason we crave them is because they were so darn rare in the environment, right? I mean, many animals have to go find a salty rock to lick, believe it or not, because salt is so rare in the environment. And now I can eat all the salt and sugar I can possibly want in 10 seconds. So I think you're spot on, and it's sad. I mean, I think in a lot of ways, big food probably didn't mean to harm people in the process, but they have. And now we have to, work on repealing that. I think for the docs that are listening, going to your hospital system and at least adding a plant-based menu option in your cafeteria and on your patient menus is very doable. I find even in my own hospital, I can't get rid of bacon or hot dogs, even though they're considered to be as cancer-causing as cigarettes. And Abbas, you know this better than anyone, right? The number one fastest growing cancer is colon cancer in young people.
Exactly. Yep.
I mean, it's mind-blowing. And yet we are serving these very things. I always tell people that $1.50 Costco hot dog will cost you much more than $1.50. So
yeah, there was at the value meal at McDonald's when you put all the cholesterol medication, hypertension, heart disease is not really worth it that much. It is I think a pandemic. We see from initially reflux, fatty liver, colon cancer, and it is and the interesting thing, as you mentioned, is doable once you go to that is sort of plant-based diet. Is really after a couple of weeks you just don't want to eat that heavy meat and all of that. I remember when my mom came here, we went to one of our doctor's friend, and he's a rancher. He put the steak in front of her, and she looked at me and said, "Is that for me?" I says, "I think so." He said, "I can cook with this for 12 people and make them more satisfied, more healthier than just that." She just looked at that. It was like, have never seen such thing can happen in the world. But unfortunately, for a lot of our patients, they got to have their sausage in the morning and their prime ribs or steak in the evening, or hamburger for lunch, and they do not want to take responsibility, rather take pills. So I think we have a lot of work to do, and I think just take one by one. Hopefully, we can make some input in our patient and our society.
Yeah, and I think we need to make this kind of conversation more commonplace. I commonly call this the American curse, where you work hard your whole life, you save your money, you get ready for retirement, and what do you look forward to? Heart attacks, strokes, dementia, erectile dysfunction. I mean, it's a terrible way to retire, and a lot of it is avoidable. And with heart disease on the upturn, right, we now are headed back up on our heart disease rates. We need to do something now. And I think doctors need to talk about it. I think doctors and patients need to talk about it. And I think it needs to be something that's featured all the time. I mean, when I say to my patient, I just want to let you know, with all due respect, I know you enjoyed your breakfast, but that sausage is considered by the World Health Organization to be as cancer causing as cigarettes. You know, they go wide eyed for a minute. Well, what do you mean? And I said, yeah, it's not me who came up with this. And a lot of people are like, oh, it's so nice you believe in this. And I said, it's not that I believe in this. This is the data, right? So my mentor, Dr. Kim Williams from the American College of Cardiology, he was bold enough to say there are two types of cardiologists, those that are vegan and those who haven't read the data. Now, it's a very bold statement with a lot of truth in it, but it's hard for people to swallow, no pun intended. So.
Just one other question about implementation when you're talking with patients. What do you have a dietitian? Do you have some books you recommend or websites you send folks to?
Yeah, no, so great question. So I think it's very unfair, right? Like a lot of us will say, oh, you should exercise and eat better, see you later. And then of course the patient comes back and they're heavier and sicker and haven't done any of that. So we have our walk program. We have a transitioning to plant-based support group, which people can find on the National Jewish website, njhealth.org. It's free, it's over Zoom. So check it out. But I also give them a packet of materials with some documentaries that I like for them to watch, things like Forks Over Knives and Eating You Alive and Game Changers, and a number of others. I usually give them from PCRM, the Vegetarian Starter Guide. Kaiser has a bunch of pamphlets. Believe it or not, Kaiser pushes this at a national level. So I have some of their pamphlets I give out. But really, I start the conversation with, what did you eat for dinner? And how much do you exercise? And get a sense of what they're doing. And then I said, well, let's focus a little on prevention, right? You're only 50 or 40 or 60 or 70 or whatever it is. Let's talk about how we can get you to feel better with less doctoring as you get older. And they're like, well, what do you mean? And I'm like, well, let's explore a few things. You already told me you exercised or whatever. But I also think it's important for all of us to master a few components of something called motivational interviewing, right? So when you talk with a patient, many times they'll give you some clues. I really like to, I don't know, walk out fishing, and I like the hike, but I can't do it because I'm not feeling well. Okay, well, let's talk about how we can get you feeling better so you can do the things you enjoy. Or I love my grandchildren. I bet all of us have had patients come in and talking about their grandchildren. Great. Well, do you want to be Grandpa Joe in the corner drooling to yourself, or do you want to be dancing at your great grandkid's wedding? And use those motivational cues and to get people to change their behavior. And am I successful in getting all of my patients to go 100% plant-based? No, I wish I was, but I'm not. But I do get almost all of them to make some changes, and probably 10 to 15% do go all the way. And the results are extraordinary. And particularly for those who've already had a cardiac event, when they enroll in our intensive cardiac rehab program, which is based on the work of Dean Ornish, the results are amazing. I mean, angina melts away, A1C drops, weight goes down, exercise capacity increases, mental health improves. I mean, it's like the most magical black box pill you could ever give. So I guess at the end of the day, asking questions every visit, what you have for dinner last night, how much are you exercising, basic things is a great way to start. And then if a patient has interest, ask for permission before you attack them, right? So if you say, well, that sucks, don't do that, you're going to die. Patients are like, oh my God, I'm not doing this. I certainly have had patients go out to the patient advocate and ask for a new cardiologist. So instead, hey, is it okay if I'm critical of your diet? And at the end, I usually say something like, look, you can eat exactly the way you're eating now, and I'll still be here to take care of you. Wouldn't it be nice to be on less medicine and feel better? And that really resonates with a lot of people, although there certainly are some who are like, no way. Yes, I've even gotten a rancher to be mostly plant-based, which is pretty amazing. So I say to sell their product as opposed to eat it. So
I think one of the things I try to push actually as one of my through the patient, I go through all their daily average menu. And one of the things I think that the cause of majority of the sleep apnea, that is the dinner in America. We have left breakfast and lunch, and we come home even plant-based, or eat and then go to sleep, and we get reflux and sleep apnea. So I try to motivate them to go for a walk after dinner and try to minimize dinner after 6 p.m. Just as you say, just give little pointers. And of course, I see them the reflux. You see them as coronary disease, and it's amazing. In even 1 week, just reducing the dinner time and just 10-15 minutes walk an hour after dinner, they feel better. They reduce some of the medicine. Yeah, I think it's. You need to get patient involved and give them I tell them I can show them the road. They have to do the walk. So I says initially they see me, but they end up with cardiology, and this number one what's the cause of death in America. So I think eating habit, the data, the time, and what you're eating. I said, well, for me, the processed food is the biggest thing that I see on my vegan and vegetarian diet, and I'm trying to educate them. And once they realize that, I think everybody wants to live longer. Everybody wants to take less medicine. It's so expensive these days. So it's a great point.
Yeah,
So
very much agreed.
So we're at 30 minutes. Thank you so much, Dr. Freeman, for doing this. And where can, do you have anything else to say? And where can our listeners find you?
So you can find me, I'm on Twitter. I'm not a very active tweeter, but you can find me at HeartCureDoc. You can certainly find me online. I work at National Jewish in Denver, so would be happy to see some of your patients if they're in the metro region, happy to do that. And then I do speak regularly, so I hope to see some of you at conferences like PPOD or the Plantrition Project or the International Conference on Nutrition and Medicine in DC this summer. But it'd be lovely to see as many of you as possible. So take care. And thanks for having me.
That'd be great. And also we have our podcast on some of the dietary, some Mediterranean diet. You may just listen if they're worthy to give it to your patients.
Yeah, I would love to do that.
Well, great for your appreciate your time. We're looking forward to meet you face to face and hopefully have maybe a few more of this conversation that benefit not us, our patient as well.
Yes, absolutely. This has been lovely. So thank you so much.
Thank you so much.
All right, take care.
You too.
Take care.